How are you?
I'm fine. How are you?
I'm fine, thank you. My name is Monte, and I'm going to be your nurse practitioner for today.
Okay.
Thank you. I'm going to be doing your head-to-toe assessment. I'm also going to be recording it for my class. Is that okay with you?
Yes, that's fine.
Okay. And can I start by asking you your first and last name?
Neokuri Alejandrin.
And can I ask you for your birthday?
May 16, 2003.
Okay, thank you. Can I ask you how you got here today?
I drove myself.
You drove here? Okay, you have a car?
I do.
And license?
I do.
Okay, thank you. Can I ask you what time your appointment was?
It was for 9.
9. Okay, it is currently, I have my watch on, but 9:05. And so you were here at the right time. And can I ask you where we are and why you're here?
We are at the hospital and I'm here for my yearly checkup.
Okay, thank you. Going based on the conversation I just had with my patient, I can see that she's alert and oriented ×4. She knows who she is. She knows where she is. She's oriented to the situation. She knows the time. She was able to get here on time, and she knows why she's here. And cognition is intact. She was able to drive here and get here. Looking at her, she's properly groomed, and I did not notice anything of concern. She's properly dressed. Her speech was clear. I was able to hear what she's saying. She's alert. She's able to understand what I'm saying and respond appropriately. So that is good. And while I was talking to her, I did not notice any horrible breath or anything like that. So far, we're good. I did go ahead and take IU vitals that were taken before I walked into the office, and everything was normal. And those tell me overall how you're doing, like your heart rate, your blood pressure, respiratory rate, and your pulse. Everything was within normal limits, so we're not going to worry about that. So just going to leave that here. And I'm going to go ahead and start with my assessment. And I'm going to start with looking at overall your skin. I'm going to do your head, your face. So basically from your head all the way down to your toes, okay? And from what I can see, your skin color is appropriate for your race. I'm not seeing any lesions, any open areas on your face, any major discoloration, any edema, so none of that, nothing of concern. I am going to go ahead and palpate your head and touch your face, body, different parts. You're going to let me know if you're in any pain. Okay, and before we begin, are you currently in any pain?
No,
Nothing. Okay. All right, I'm going to go ahead and palpate your head. You let me know if anything hurts, okay? Okay. Her scalp is clean. She doesn't have any lesions. She doesn't have any edema, any open spaces. I did not notice any parasites in her head. Her head is symmetrical as it should be, and it's round, the size that it should be, and her head is appropriate for her body. And also something I did notice in general survey is she's well developed for her age and gender. So that is in there. Okay, I'm going to go ahead and look at your face, which is symmetrical. Nothing, no open spaces. Your skin is warm. Okay. It's turquoise, skin turquoise, good. No signs of dehydration. I don't see any drooping of the eyes. No, nothing coming out of the eyes. No drainage from the eyes. I see proper distribution of hair on her head. The eyebrows, the eyelashes, everything is where it should be. I'm gonna go ahead and I'm gonna go ahead and look at your maxillary and frontal sinuses. I'm gonna pop in on them, and you let me know if anything hurts. Okay. Anything?
No.
Okay. Anything?
No.
Okay. And I'm going to go ahead and test for the optic nerve, which is cranial nerve number 2. I'm going to be behind you, and when my hands or fingers come into vision, you let me know. Okay. I'll be right behind you. Okay.
I see it. Okay. I can see it. I can see it. I see it. I see it. I see it.
Okay, so your cranial nerve number 2, which is the optic nerve, is intact. You were able to see my hands up far on this side, on both the right side and the left side, so cranial nerve number 2 is intact. Thank you. All right, I'm gonna go ahead and, did I skip stuff? Yes, I did. And test for cranial nerve number 3, number 4, and number 6, okay? I'm gonna shine this in your eye just to see how it reacts, okay? Okay, so the eyes are reacting appropriately when I'm shining the pen light in her eyes. They're constricting as they should. I'm gonna go ahead and shine the light in her eye and look to make sure that the other eye responds, which it does. And I'm also gonna shine here and take a look at my right eye, which is also responding. So not only does the eyes that I'm shining the light in respond, but also the other eye responds, and that is consensual response. So both of them have direct and consensual responses. I did notice the pupils are round, they're responsive, and there's no drainage in the eyes, so that is good. And pupils is symmetrical and sizes on both eyes. Sorry. Let me see. Your eye, the pupils are about 3 millimeters on both sides. Okay. Now I'm gonna want you to look at my pen light as it comes closer to you. Okay. Don't move your head. Just concentrate on it. All right. All right. Here I was testing for accommodation. The eyes did come in closer and concentrate on my pen light when I got closer, and as I pulled away, they did dilate and converge on the other side. So that one is intact. I'm also going to ask you to continue looking at this. Don't move your head, but just follow my pen light as I move it, okay? I'm going to start here, 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 and here. Thank you. So that completes cranial nerve number 3, number 4, and number 6. Her eyes were able to accommodate. They were able to constrict and dilate appropriately. And yes, so that completes. So those were optic nerve, the abducens nerve, the trochlear nerve, and ocular motor nerve. So that completes those nerves. I'm gonna also go ahead and test, while we're still on the head, test cranial number 5 and number 7. I'm gonna touch places on your face and you let me know where I touched, okay?
Forehead, cheek, chin.
Okay, thank you. I'm gonna ask you to open your jaw, close your jaw, okay? So it's responding appropriately. I feel the strength, it's strong. And I'm going to also ask you to smile. Okay, frown. Puff your cheeks. Okay. Raise your eyebrows for me. Okay, you can unpuff your cheeks, it's okay. And then close your eyes really, really hard. Okay, thank you. So that was testing for the facial nerve and trigeminal nerve, cranial nerve number 5 and number 7, which both of them are intact. And while I'm here, at the shoulders, I'm also going to test, let's do neck. Okay. We did the eyes. Okay. I'm going to go ahead and test your ears now. Okay. I'm going to look on the outside, look in the inside, see if I see anything, and then we're going to also do some hearing tests, okay? Alright, looking at the outside, the pin is good. There's no lesions on it. There's no edema. There's no scarring. And that is the same for this ear. I'm going to go ahead and take a look. Okay. Okay. Tympanic membrane is intact. I don't see anything in there of concern. There's minimal wax as expected. I'm also going to do the same here. normal on this one as well. Okay, we're gonna test cranial nerve number 8. Okay, which is the, I just forget, the vestibulocochlear nerve, which is cranial nerve number 8. Okay, can you cover this ear for me? Okay, I'm gonna whisper something here, and then you tell me what I said. Okay.
1, 2, 3.
Okay, cover that one for me. ABC.
ABC.
Okay. Both ears here. We're gonna do the Wren and Weber test. Okay. I'm gonna first start by testing air versus bone conduction. So I'm gonna ring this. I'm gonna place it on the bone right above your ear. And when you can no longer hear it, you let me know, and I'll bring it to air conduction. You should still be able to hear it, even though you can't hear it with bone conduction. And I'm going to do that in both ears. And then I'm going to ring it again and put it on the bone right here at the top of your head. And you should be able to hear on both sides at the same time. But if you hear it more on one side than the other, you let me know. Okay? Ready?
I can't hear it anymore. I can still hear it.
Okay. Let's do the other ear.
I can't hear it anymore. I can still hear it.
Okay. Can you hear it?
I can't.
Do you hear more one side versus the other?
No, I hear it equally.
Okay, so that was testing lateralization, making sure you can hear equally on both sides, which you do. So that is good. So that completes our section on the ears. Okay, I'm gonna go ahead and test your nose and your sinuses. I'm gonna look inside your nose, and I'm also gonna test for cranial nerve number 1, which is the olfactory nerve. I'm gonna have you smell something, and I'm gonna want you to identify it for me. Okay?
Okay.
All right. Okay. From what I can see, your nose is straight. There's no skin issues on your nose. I'm not seeing any drainage, so that's good. Go ahead and look inside. Okay. The septum is in the middle, it's not deviated. And the inside is nice, moist, and pink. So that's good. Okay. Can you hold one near right here and smell it? Can you smell that one? Air potency is good. Do it in the other ear for me. Okay, that's good. I'm gonna have you smell something. And let me know what you smell. Okay.
Mint.
Correctly identified. It is mint oil. So that's good. We are done on the nose section. I'm going to go ahead and test your sinuses, the maxillary and frontal, and you let me know if anything hurts, okay? Any tenderness in there?
No.
No? Anything here?
No.
Okay. That's good. That's testing for any sinus infections, and it's not tender, so which meaning you don't have any infections on that part. Okay, we're gonna go ahead and look at your mouth. I'm gonna look inside. All right, and we're also gonna test for cranial nerve number 12, which is we're gonna test for cranial nerve number 9, the glossopharyngeal, 10, the vagus nerve, and 12, the hypoglossal nerve. Okay. Looking at the mouth, the lips are pink, appropriate to skin color, and they're moist. Can you smile for me? Okay. Teeth are the color they should be. Let me see your gums like this. Okay. I don't see any bleeding so far. If you're gonna go ahead and open your mouth for me. Okay, I'm gonna go ahead and take a look. Okay. I do not see any. Smile again for me. I'm not seeing any missing teeth, or any loose teeth in there. The tongue is pink as it should be. It's midline. Stick your tongue side to side for me. Okay, it's good. Say Okay, the uvula arises with the tongue as it should. Hard and soft palate are good. Good, let me see here. Okay. You do have a tooth that appears to have some black mark on them. It's one of your bottom teeth. Okay, can I ask you when the last time you're aware that you do have that part right there?
I am.
Have you brought it up to the attention of the dentist?
No, I have not.
Do you visit the dentist regularly?
No, I do not.
I do not. When was the last time you were at the dentist?
2016.
2016, so 9 years ago. Can I ask you why you haven't been at the dentist?
There's no specific reason.
No specific reason. Do you have health insurance?
No, I don't.
Not at the moment. And that hasn't been the reason why you haven't visited?
No.
Okay. We might see if it's a possible way for you to be able to go in and see a dentist, because that could be of concern. Okay. But overall, the patient has great hygiene in the mouth, no halitosis noted, no loose teeth, no missing teeth, and cranial nerves number 9, 10, and 12 were all intact. Okay. I'm gonna leave that part, and we are gonna go. Oh, I'm also gonna ask you to swallow. Okay. I was testing for the gag reflex. She's able to swallow. Okay. Let me see. What else should I test for? This part. We're gonna go on and move to the neck and the lymph nodes. Okay. I'm gonna palpate your nose, your neck. Okay. Okay. Let me know if anything hurts anywhere in the neck. Anything? No? Okay. I'm going to test for cranial nerve number 11, which is the accessory spinal or spinal accessory, one or the other. Go ahead and lift your shoulders for me. Okay. Your head back towards my hand, against my hand. Okay. Against my hand. Push down against my hand. Push down against this hand. Good job, thank you. Cranial nerve number 11 was intact. The patient was able to push against my hand on the shoulders and the back of the head in front, left and right, so that part was intact. I'm gonna go ahead and feel her lymph nodes. You let me know if anything hurts, okay? Alright, so these are the preocular, postocular, occipital, post-cervical, deep cervical, superficial, tonsillar, submandibular, submental, and are you okay if I move this a little bit? Okay. And supracervical. I did not feel anything in any of these lymph nodes I did test, so far it's fine. While I'm still here, I'm also going to go ahead and do the axillary lymph nodes. You okay with that? Can you lift this end up for me? Okay, nothing. Let me see this one. Okay, thank you. Nothing else to felt in there, so far we're good. We're gonna move on to our next section. Is gonna be respiratory. But while we're still up here, I'm gonna go and fill your carotid artery and also listen to it. Okay. Feel it here pounding, and it's strong. I'm also gonna feel it here. Okay, there on both sides, it's strong and equally strong. I'm gonna go ahead and listen to it using the bell side of my stethoscope and listen for any bruise. It should be whooshing sound. Hopefully I don't hear any, but if it were to be in there, that is what I would hear. There were no bruise heard. There was no whooshing sound. Meaning that you're fine, you're healthy on that part. Okay, our next part will be respiratory. I'm going to be listening to your lungs and see if there's any concern. So far, I don't see any use of accessory muscles. I don't see any chest restrictions. So far, we're good. Do you have any shortness of breath? Are you experiencing any shortness of breath?
No.
Awesome. Okay. All right, we're going to continue with our respiratory part of the exam. I'm going to go ahead and palpate, so I'll touch and you'll let me know if anything hurts, okay? Nothing?
Nothing.
I'm going to do the same in the back. Let me know if anything hurts, okay?
Nothing.
Nothing? Okay. Alright. Go ahead and turn back to the diaphragm. Okay. I'm going to begin on your right side. I'm going to be listening for bronchial sound. Oh, and before I continue, I know we're never supposed to listen over bone or over clothing, but for some parts, my patient is not comfortable being on video without proper clothing, so I'm just going to go ahead and demonstrate around the area of where I would be doing it. So I'll begin on the right side and listen for bronchial sound. Take a deep breath for me. Okay, deep breath. Okay, so I'll go down right here for vesicular, bronchovesicular, sorry. Okay, go back again right here. Okay, then down here, we'll do vesicular. Okay, and vesicular. Thank you. Did I go in the correct order? I'm going to go ahead. I'm not sure if I did do in the right order, so I'll go ahead and repeat that. Ready? So bronchial, breathe for me. Bronchial. Okay, bronchovesicular, breathe for me. And bronchovesicular. Okay, down here for me. Right here. Take a deep breath. Okay, right here. Okay, thank you. Okay, and from what I can see, part of the chest area, I do not see any use of accessory muscles. I do not see any retractions. Any issues with skin or anything. Her skin is intact, and there's no lesions or an edema on this part of the body. I'm going to go ahead and ask you to turn around for me. Okay. Alright. I'm going to go ahead and palpate back, which we already did actually. So I'm just going to go ahead and listen. I'm going to begin on your right side. And we listen around the scapula bone and the back. Okay, sorry. Take a deep breath for me. Okay. Deep breath for me. Thank you. Those are bronchial sounds. We're going to do bronchovesicular. Go ahead. Okay. Right here. Go ahead. Thank you. And I'm going to do vesicular. Thank you. Sorry, I'm sorry. Go ahead. Thank you. Just listen on the side. Take a breath. Okay, on the side. Take a breath. Okay, thank you. And this part completes our respiratory part of the exam. Okay, I'm going to go ahead and test for tactile firmness. I'm going to have you say a number for me, and I'm going to make sure it's vibrating on both sides, okay?
Okay.
Say 99. Good.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Thank you. If you could turn around, and we're gonna test over there as well. Okay. Say 99 for me.
99.
Okay.
99.
Okay. Sorry.
99.
Thank you. And I think that completes it. You're gonna go ahead and percuss your lungs. So wherever it is that I did go ahead and listen with that stethoscope, I'm also gonna go ahead and listen to make sure the sound is what it should be. Okay. Okay. I'll place my 2 fingers there and. Okay, if you could lift a little bit here for me. And I'm gonna go on this side. Sorry. Right here. We're gonna go turn around for me so we could see your back. Thank you. Right here. Okay. And here. And here. Okay. So your sounds are as they should be, nothing abnormal observed. So we are going to go ahead and move to our cardiac section of the assessment. If you could turn back around for me. Okay, we're just going to go ahead and continue with our cardiovascular system assessment. I'm going to go ahead and palpate. Let me know if anything hurts, okay? Nothing?
No.
Here?
No.
Here?
No.
Okay. So when I go ahead and listen, I'm going to ask you, there's a part I'm going to ask you if you could like move up your boob a little bit for me so I could go ahead and listen to the mitral, yes, the mitral, the mitral part, okay? You ready? Okay. Go ahead and make sure it's in the diaphragm. Okay. We'll first listen to the aortic, which is in the second intercostal space on the right, and then the pulmonic, which is on the second intercostal space on the left. And I'm gonna move down, sorry, a little lower. To listen to Erb's point. And at this point right here, this is normally where we'd have both S1 and S2 sounds equal. So that's where we would be listening for any abnormalities on the heart, mostly at that part. If we have any whooshing sounds, anything like that over here, that's where we'd listen to it. Okay, I'm gonna go down a little bit lower in here. It's her closer over, but it would be somewhere around here, mid-clavicle, between the fourth intercostal space. And then your mitral, if you could lift up a little bit on that side for me. Will be around this area. Okay, I'm just gonna go ahead and listen with the bell and see if I hear any bruise or any other abnormal sounds. It's gonna be in the same spaces I just listened to. The aortic, pulmonic, sorry, Erb's point, and around here we would have tricuspid, and lastly around this area we would have the mitral part of our exam. So I did not hear any abnormalities in this part. There was not any murmurs or any gallops, any abnormal sounds. What else? No bruise heard in this part of the exam. So for her cardiovascular part of the exam, do pass. Don't have any abnormalities, any heart issues. Okay. All right. At this point, I'm going to go ahead and test your muscular skeletal system. Okay. I'm going to go ahead and feel your arms. Checking for muscle tone. Checking for skin temperature. I'm looking for any lesions, any edema, any scarring, or any other skin issues that I should be aware of. And I don't see any. She doesn't have anything of concern. Can I see your hands? I'm going to go ahead and I'm checking for capillary refill. Both were under 2 seconds. If you could go ahead and squeeze my fingers as hard as you can. Awesome. I'm testing for strength of her hands. Both hands were strong and equally strong on both arms. If you could go ahead and bend your elbows for me. Okay. Extend them for me. All right. If you can add and circumflex. Okay. Go ahead and do your wrist like this for me. Okay. So range of motion is intact in the shoulders and the wrists. Also and the elbows. I'm going to want you to push down on my hands. I'm going to go like this. Push down. All right. Push up. Okay. So strength is also intact in the hands and elbows. Let me see if I move here. I'm going to go ahead and do your deep tendon reflexes. Okay. Let's see. Go ahead. Let me start here. That is your... Did you move anything? Just a little bit over here. That was your biceps, brachioradial. Just a little bit over there. And which was the other one? Let's see. Okay. We're going to do the same in this arm. Biceps, a little bit. Brachioradial. That was radial. Okay. Go ahead like this. And triceps a little bit. Did I twist on this one? Okay. Okay. Your deep tendon reflexes are reactive as they should be. We're going to go ahead and move to the bottom. Your lower extremities. We're going to do the same thing we just did above. I'm going to go ahead and palpate your skin. I'm looking for skin muscle tone. I'm checking for color, which is appropriate to your skin, to your race. I don't see any discoloration. I'm not seeing any lesions, any open spaces, and I do not see any edema. That is good. Yeah, I'm gonna feel those. I'm gonna ask you to bend your knees for me. Okay, and abduct your, go ahead and adduct. Move this same way, abduct and adduct. Okay, if you could go ahead and extend your knee. Okay, extend your leg, bend it. Extend your knee and bend it. Okay, can you wiggle your ankles for me? Awesome. Okay, can you push up your leg, just up to the sky, and then bend them? Awesome. Go ahead and put them down for me. Can you push up your knee? Okay, push up your knee. Okay, push up against my hand here. All right, push down my hand. All right, push up against. All right, and push back down. Awesome. So I was testing for strength on this part. Strength was equal on both sides with everything that I tested. Range of motion, she has no limitations. She has full range of motion in both sides, so that is good. I'm gonna go ahead and feel her pulses. There's a pulse, I don't know if you could see it, between her big toe and the second big toe in the middle where the arch begins. It's palpable and it's strong. I'm gonna go ahead and test it on this one. Okay. It's also palpable and strong equally to the right leg that I tested off first. There is patellar one under the knee in here. Okay, a little hard, but it's there. I'm gonna go ahead and test it on this leg. Bend it for me a little bit. Okay. Okay, thank you. There's also a femoral one, which will be kind of like in here a little bit, but I'm not gonna go ahead and find it in outpatient. But if you deep palpate it, you should be able to feel it. I'm gonna go ahead and test for her radial pulse. Should I feel it? Go ahead and feel it on here as well. Okay, they're palpable on both sides and equally strong. I'm going to go ahead and do the brachial radial, which is on the inside of the antecubital space right here. Okay, feel it right here. Go ahead and feel it on here. Okay, I also feel it on this hand. I'm gonna go ahead and test the deep tendon reflexes on the bottom part of my patient. I'm gonna go ahead and test right here. Yeah, keep your leg loose right here for me. Awesome. I'm gonna go ahead and test this one. The patellar. Awesome. I'm gonna go ahead and test this one, and if you can see it, it's down here at the foot on the outside. Okay. Okay, they're intact. Thank you. I'm gonna go ahead and test your Babisky. It's gonna be under the foot, and she should be able to like bend her toes like this if it's intact. Which you could see as she bends her toes. Make sure it's bilaterally. Okay. We also see that right here. Tendon reflex on Achilles. That would have been back here. And right here. I think we are done with the lower extremities. At this point, I believe I'm going to ask you to stand up for me. Okay. Alright. Where you're standing, I'm going to ask you to jump in space a little bit. Okay, so you should be other leg. Awesome, thank you. I'm going to make this so you can walk. Go back right here for me. And, sorry, walk straight for me this way. Heel to toe, sorry. Heel to toe. Alright. Look up straight. Okay. Thank you. And while you're going back, hold your hands up to your chest and walk that way for me. Do the tendon walk, yes. Alright. Awesome. Thank you. Turn back this way. Go ahead and touch your nose for me. Close your eyes and touch your nose. Okay, awesome. That is intact. Let me make sure there's nothing else I want you to do while we're up. Alright, if you can come back here for me. Go to the side a little bit. Can you bend down and almost touch your toes? Alright, so here I'm looking to see if her hips are aligned and as well as the scapulas, which they are. If they weren't aligned, it might be signs of scoliosis, but the patient, her hips are aligned, and so are her scapulas, and her spine is perfectly aligned. You can come back this way, stand up for me. Okay, if you turn to the side, actually that's fine. I'm also looking for lordosis and kyphosis by looking here and here. Out here it's not more outside than it should be, and down here it's not more inverted than it should be, so she does not have any signs of scoliosis, kyphosis, and lordosis. Turn around for me this way. I believe that's how we're doing for this part of our test. We're gonna go ahead and do our abdomen. I'm gonna have you lay down somewhere for me so we can do your testing of the abdomen.
Okay.
While we're still standing, I'm gonna ask you to bend down for me to your right side, bend to the left side. Okay, can you twist around? Okay, can you turn around and do the same for me? Okay, to your right side, to your left side. Can you twist? Okay, did anything hurt during this whole process?
No.
Okay, awesome, that is great. We are gonna continue to the abdomen.
You have my shirt on?
Okay. On this section, we are gonna go do the abdominal test. I'm gonna begin by inspecting my patient. I'm looking for any visible masses, any pulsation, see if she's pulsating. I don't see anything. I don't see any skin issues, none of the sort. So I'm just gonna go ahead and take a listen. I'm gonna begin with the bell. Okay. I'll begin by listening at the aortic, abdominal. I'll listen to the renal arteries and the iliac. Okay. 3 fingers up above the, what is this called? The umbilicus is the aortic abdominal. Okay. And then 2 fingers up above, and then 2 fingers over. That will be the left renal. All right. 2 fingers up and 2 fingers over will be the right renal. All right. Now 2 fingers under and 2 fingers over to the left side is the left iliac. All right. 2 fingers down and 2 fingers over is the right iliac. All right. And I do not hear any buoys on this part, so everything is good. I'm gonna go ahead and switch to the diaphragm and listen to abdominal sounds. Okay, she does have active bowel sounds in all 4 quadrants, and at this point I'm gonna go ahead and percuss. Ready? It should be flat where there's bone. It should be dull when it's above organs, and then when it's air, it should be tympanic. Right. Alright, everything sounds as it should sound. So at this point, I'm gonna go ahead and palpate your stomach. Okay? Alright. I'm gonna lightly palpate and you're gonna tell me if you feel any pain. Okay?
No.
Okay. Alright, so it doesn't feel any pain. I'm gonna go ahead and palpate even deeper to see if I feel any masses or anything like that. And I'm also gonna be checking to make sure that the organs are in their place. And the right lower, there should be the appendix. And the right upper, I should feel the liver and the gallbladder. And in the left upper, I should feel the spleen. And there's one more. The spleen and the pancreas on the side of the stomach. Alright, I'm gonna just go ahead and palpate or down and let me know if anything hurts. And on this right lower part of the abdomen is what McBurney's point would be, and if I suspected that my patient had pancreatitis, I would go ahead and push down on it and quickly release. And if she felt any pain or a lot of pain, I would suspect that she has pancreatitis, but my patient did not react, so she does not have anything like that. Okay, I did not feel any masses or anything that shouldn't be there. Everything felt in place. So I'm going to go ahead and ask you to cover your stomach because we're done with the abdominal test. Okay, if you go ahead and sit up for me if you're okay with that. Okay. Alright, I do have a couple more questions for you before we complete our exam. When was the last time you had your bowel movement?
Probably yesterday.
Yesterday. Do you normally have them regular?
Yeah.
Like every day or like every other day?
Every day.
It's usually every day. Okay. What's the color, would you say?
Brown.
Do you have any constipation?
No.
Any diarrhea?
No.
No. Any pain when you go to the bathroom?
No.
You notice any blood in your bowel movement? No?
No.
Awesome. Okay. Okay. What about urinary system? Do you pee regularly?
I do.
What's the color of your urine?
It's like a pale yellow.
Hello. Do you notice any odor?
No.
No. Is it cloudy or is it clear?
It's clear.
It's clear. Awesome. Any blood in there?
No.
Do you feel like you have to pee all the time?
No.
Do you have a hard time peeing?
No.
Do you hurt when you pee? No. Any burning when you pee?
No.
No. Awesome. That's awesome. Do you have your period normally?
Yeah.
Is it every month?
Yes, once a month.
Okay. Do you have any heavy bleeding?
No.
Any extra pain?
No.
Awesome. And you're 22. Have you visited that gynecologist?
No, I have not.
Do you plan on doing so anytime soon?
Yes.
Okay. Do you need help scheduling it?
I do.
Okay, we'll go ahead and refer that. You do know 21 and above, you do get yearly gynecologist pap exams. We recommend you go do those. What about breast exams? Do you perform self?
I do.
How often do you perform those?
Once a month.
Once a month. Around when do you perform?
After my period.
After those. And have you noticed anything
No.
of concern? Okay. Awesome. That completes our assessment. Except there's one part I did not get to do, and that will be vibrations on your hand and on your foot. I'm going to go ahead and do those, and after that we are done. Okay? Alright, you ready?
Yeah.
Let me see your hand. Do you feel any vibration?
I do. I do.
Okay, I'll check the other one.
I feel it vibrating.
Okay.
I feel the vibration.
Alright, I'm going to go ahead and do your foot. If it's inside or outside.
And I can feel it.
Okay.
There too.
Okay.
I feel it.
Okay. I'm gonna assess your joints. Any pains in here?
No.
Nothing. Okay. Here.
No.
Okay. Into your hands. No pain in here.
No.
Nothing in here. In here.
No.
Nothing. Okay. That completes our exam. Thank you for coming in. Everything was normal. Nothing abnormal. The only thing I would follow up on was scheduling your gynecologist appointment, and as well as seeing a dentist for your tooth. And I'll check up with you probably in a year, or whenever a concern rises up, do contact us and come back to the office.
All right. Thank you.
Thank you for coming in, and thank you for helping me with my assessment for my
Of
class.
course.
Thank you.